Hello. Now, today we're going to have a look both at health surveillance and why we do it, and we're going to use hand-arm vibration syndrome as an example and have an overview of hand-arm vibration syndrome, really focusing on the Tier 2 assessments, which we do so many of. Above all else, please don't worry. This is going to be information heavy. There's a lot to HAVS, and that's why I've put in these little need to know stickers, because you don't actually need to know or learn all of this. I've included a lot of information for interest, for context, for a reference, and just to help you understand what we're doing and why we're doing it. So let's start with the obvious. What is HAVS? Because it's not actually just one thing. It's divided up into the vascular, the circulation, and that's what most clinicians would recognise as a Raynaud's disease. There's also a neurological aspect to HAVS, and that's just a peripheral neuropathy, but it's affecting the fingertips. And finally, there's a musculoskeletal, which is fairly non-specific arthritis and pain in the hands and the forearms. Almost impossible to differentiate from any other muscular problems in the upper limb. But it is recognised in the literature, it's recognised by the Health and Safety Executive. So at least we've mentioned it. The important thing about HAVS is not the Raynaud's, the neuropathy, the arthritis, because there are many causes of that. The important thing in HAVS that it is the exposure to vibration from power tools which is causing the conditions. Also, we need to remember that HAVS can't be cured. Once the damage is done to the hands, it's not going to get better. And that's why we need to focus on spotting it early, on making sure it doesn't get any worse, on preventing it. So we'll talk a wee bit about the vascular HAVS, which we would recognise as Raynaud's phenomenon, very common, many of us have it. The employees in the factories will often call it white finger. It's a term which should have been phased out, but it's very descriptive. Everybody knows what they mean, so you'll still hear people talk about white finger, including me. The fun bit for us is that it's only occupational health who understand that vibration is a common cause of Raynaud's phenomenon. So when we spot it and diagnose it, we can be a little bit proud and a little bit smug. No harm in that, as long as we keep it under control. And the symptoms are just the same as any other Raynaud's phenomenon. Circumferential blanching. The fingertip goes white all the way around. It's not just a little bit blotchy. And the finger will feel dead, and it gets triggered when the hands are cold, so if they get wet, or if you're holding air tools which get cold, or if you go outside on a cold day or ride a motorbike. Classically it goes white, and then as the circulation comes back it goes blue, and then it goes red. I've never known anybody describe it like that. Again, just to remind ourselves that it's vibration which is doing the damage, but it's cold that triggers the symptoms. And that distinction is very confusing, and certainly the employees often don't make the link. So to them, their hands are bad when they're cold and they want to keep them warm, which helps to an extent, but it isn't dealing with the cause of the problem. And there it is, in the best tradition of these things, one I prepared earlier. That's real one from an individual I assessed a lot of years ago now, and he kindly gave me permission to use his picture. And there you can see 4 of his fingers have gone white, and 3 of them have gone down, well, 2 of them have gone down 2 segments. So when we're doing our HAVS assessments, we're trying to differentiate from the primary Raynaud's, the type of Raynaud's that you're just born with, or the other types of secondary Raynaud's, the people who have arthritis or they're on beta blockers, or the heavy smokers. They're all important, but we're interested and we're focusing on the vibration because obviously that's our area. Neurological HAVS, classically described as numbness or tingling in the fingertips, and it must last for more than 20 minutes. So it's not just a bit of a buzz or pins and needles when you set the tools down. It often starts before the more dramatic looking white finger. Did it again, didn't I? And it's easily missed because it creeps up and people don't really notice it. And that's another very good reason why we actively ask them, do they have symptoms, so that we can then look into it in detail for them. Of all of these, it's the neurological HAVS that can be the most disabling. If you can't feel, you can't use your hands. And if it gets bad, people lose their jobs, and they can't do simple things like buttons. So it's an important condition. Now, I've talked about the peripheral neuropathy. There is the other bit of neurological HAVS, which is carpal tunnel syndrome. Again, we're fairly familiar with that. And the textbooks all say that it's numbness, pins and needles on the thumb and these 3 fingers. Patients will tell you just the whole hand goes numb, and that they tend to wake up with their hand feeling dead at night and they have to hang it out of the bed and shake it. Carpal tunnel syndrome, of course, very common. It sometimes just happens, or it's associated with ergonomics and gripping and pulling, but vibration can damage the big median nerve. And the difficulty with this is, firstly, it's almost impossible to separate carpal tunnel syndrome caused by vibration from any other carpal tunnel syndrome. But some of these individuals, when they get their carpal tunnel surgery, get a disappointing result because it wasn't really a problem of pressure on the nerve, it was vibration causing damage to the nerve. And let's remind ourselves that other causes of peripheral neuropathy exist. So not everybody in a factory with pins and needles, numbness in their fingers has got HAVS. They might just have diabetes, or often you will see people who've had chemotherapy and they're left with pins and needles as a side effect of their chemotherapy. That's where HAVS is actually quite fun, because you're doing a little detective job, trying to solve a puzzle to decide what the cause is and is this something to do with work. Musculoskeletal HAVS, yeah, well, it's there. Trigger fingers, dupitrons, or just aches and pains. Completely impossible to say whether it's work related or anything else, and for that reason it doesn't tend to attract a lot of attention. Okay, so I've been telling you a bit about the clinical aspects of HAVS, and I've kept talking about vibration, so let's go into that a bit more. Vibration, I just mean that power tools, especially air tools, with a motor inside that's spinning, they will vibrate. And that vibration is transmitted into your hands, and that vibration can damage the little nerve endings and the blood vessels in the fingers. Your hand is mostly sensitive to quite low frequencies. The manufacturers of the tools They will all publish their vibration data. They're hopelessly optimistic based on the laboratory situation that always favours the manufacturer. It used to be that you were trying to guesstimate vibration exposure by asking them what tools they use, how long they use them, how often they use them. Employees don't know, they overestimate how long they have the tools running. Nowadays it's so much easier because these accelerometers built into a watch or that can be clipped onto a tool allow direct measurement. So if an employer comes and says they think people are exposed or they don't really know, I'm quite unimpressed. It is quite easy to get these devices, put them on a few of the employees, know where the vibration is, know how much it is, and then really work from that position. And as well as giving confusing numbers like that 267, they have a nice simple traffic light system. Green, pretty safe. Yellow, potential for damage. Red, stop. And this is covered by legislation, another unexciting topic. The important thing for us to know is the legislation tells you how much vibration is permissible. So anything over 400 points, which is red on that little machine, is illegal. Between 100 points and 400 points, the person is at risk, so they are required to have health surveillance. Under 100 points, probably not going to cause damage, though you can't absolutely guarantee it. And of course, whatever the vibration levels are, the employer still has a duty to reduce it as low as reasonably practicable. So that 100 points or 400 points isn't a target. You can't just sneak under it. You've got to do your best. Okay, so we've been talking about the employers. Let's think about where we're going to come across this. And it's the stuff you might expect. It's construction, it's heavy engineering and manufacturing. Increasingly, we're getting to see the groundsmen who use strimmers and hedge trimmers. They had been quite ignored, and they are exposed to a lot of vibration. But it's not actually the industry the problem, it's the tools they use, such as chainsaws and strimmers and great big hacksaws and grinders. And there's a whole language of its own. When they come in and you ask them what they're using, they'll tell you it's a still saw, still as a manufacturer, but you start to tune into what the factory has. Okay, let's play a little game. So I've got 4 tools there, and I'm going to take a break and stare out the window, and I'm going to ask you to put them in order from the highest vibration to the lowest vibration. So, no birds out, no birds eating my seed. That's all right, happy with that. Okay, how did you do? Well, let me see if I can work with you. So we've got the dentist's drill, and it's there to make the point that that's totally safe. It's very low amplitude, very high frequency. It's not going to cause halves. The green thing next to it is a chipping hammer. Those chisels go into it and it bangs in and out and in and out. It's huge, horrible things. You can only use those for about half an hour and you've busted your 400 points. Modern battery drill, they're lovely. Rubberized grips, bushes and mountings inside to isolate the motor and the gears from your hands. You can use that all day, it's not going to affect you. Whereas this knackered old 1950s drill was always going to be high vibration, and as tools get old and the components inside wear out, then they vibrate more. So it might have been a good tool in its day, but if it's not maintained, if it's not replaced, then it starts to become a problem. And we see a lot of that. But it's got to be about the people. And just like losing your hair and losing your hearing, some people are more susceptible to developing HAVS. In fact, there's a link between hearing loss and baldness and HAVS. So I'm quite glad I don't work in a factory. And in very rough terms, there's the high-risk individual who develops the symptoms within the first couple of years of starting to use these tools. They can progress rapidly, they can get severe HAVS, so we're going to watch them very tightly. We probably need to restrict them if they're getting worse. We might even have to say, look, time to change your job. Then there's the low risk. There's the guy who's about 64, he's hoping to retire next summer. Yes, he's got some blanching in his fingers, but he's been doing the job for 30 years. He's only had this for 4 or 5 years. It's not bothering him too much. That's not going to progress before he retires. So even though we're going to keep him under review and we're going to chat to him, we're going to take a fairly relaxed approach. What do we do? Well, the health surveillance. Why do we do it? Well, because you can't just wait for people to turn up and say, I've got a health problem. We need to go out, we need to ask them directly and look for it actively. And then when we do find problems, it gives us a chance to talk to these employees, to help them understand what's happening, to help them make decisions and keep them involved in protecting their health. And we can go back to the employer and say, look, we're seeing lots of problems in workshop A, but everybody in workshop B seems okay. You need to look at your controls and your risk assessments in workshop A, because maybe there's something we could do better. And you get the not so good reasons for doing this. Like the employers realise they've got to obey the law, and they say they've got to do health surveillance. They say, can you do the health surveillance? Yeah, love to. Or they're in trouble because the HSE are on their back and threatening to close them down. And they come to us in a panic. Great, we finally got the leverage to get in there and work with these people. Or somebody goes to the solicitor and says, I've got HAVS, I've got white finger. And the solicitor says, ooh, goody. And they set up in a hotel outside the factory gates and start leafleting and canvassing. And you get class actions, and I've known that happen in a few places. It's a bad thing, except it gives us the opening to start improving things. So how's the health surveillance done? Well, it's done in tiers. So tier 1 and 2 are basically the same thing. It's a questionnaire just asking the employee if they have symptoms, and if they do, then we're going to escalate. So tier 3 done by a qualified person who's done training to assess HAVS in detail, and that's a 2-day course. And tier 4 is me, having done the same 2-day course. The difference is I'm allowed to formally diagnose HAVS and trigger all the consequences that flow from it. Okay, so that was a bit abstract. Let's talk about some made-up examples. So we're going to start with Mr. Wielder, who's a welder. Not easy to say. In his 50s, been working at welding and fabricating for 30 years. And as you can see, he's using grinders and hacksaws for hours a day. And on his questionnaire, he says, yes, his fingers go white when he's using the air tools. What do you think's happening? I'm going to look at the cherry blossom. It's lovely. Just gorgeous out there. Sorry I can't show you. Well, what he's doing is he's telling us, probably, that he's got vascular HAVS. The thing with the air tools is they get very cold, and that's what triggers the attack. but of course they're also a vibrating tool, so they're both the trigger and the cause of his HAVS. So this is somebody who's going to need a Tier 3 or a Tier 4 assessment, and then of course once we've done all that, we'll be making recommendations to manage the situation. And here's Mr. Chisel, who's been working as a fabricator for 40 years, long career. He's getting close to retirement age. He's using vibrating tools for a few hours every day, and he's saying yes, his fingers go white, and he's also getting pins and needles in his right hand. So what do we think? More staring out the window. Should have been a civil servant. I'm good at this. I could do that all day, you know. Okay, well, basically he's also likely to have vascular HAVS. He might, with those pins and needles, have neurological HAVS. Significance of the right hand is it tends to be in the hand that holds the tool, because it's getting more exposure to vibration. And then Mr. Prentice, who's a young lad in as an apprentice. He's going to be a paint sprayer, but because he's the apprentice and because paint sprayers have to prepare the surface before they apply the paint, he spends hours and hours a day with an orbital sander sanding down metal to paint buses or cars or whatever it's going to be. And even though he's only been doing the job for a couple of years, he's saying, yes, I'm getting a bit of tingling in these fingers, and it lasts for half an hour. What do you think? Of course, you see what I'm getting at. This is the high-risk person who might be describing the very first symptoms of neurological HAVS. It's tough, because he's new into his career. He's probably also at that point in life where he's starting to look at buying houses and setting up family, and he really needs his job. And yet, I'm already starting to think, are you in the right job? We're going to monitor you carefully. We're going to get your Tier 4. We're going to talk about maybe restricting you if it gets any worse. Could have big consequences. And here is Mr. Herring. Hopefully the name gives you a clue. So, relatively young man, or certainly from where I'm sitting, he's a young man. Yeah, he's using a bit of vibrating tools an hour a week, but most of his job doesn't include hand transmitted vibration. And he says his hands go numb at night. And I've already told you the answer to that one if you want to rewind. Carpal tunnel syndrome. Or that's our first thoughts. Obviously you've got to look at it. You've got to do your Tier 4. He probably needs to go off for his nerve conduction studies, which will be organised through his GP. And he might end up with carpal tunnel release. He probably also needs to have a look more at the ergonomics of that job with all this digging and waving stuff around, because his vibration exposure is already pretty low. And just to close it off, let's do the end of the story. This is what happens at Tier 4. Don't panic about the chart. I've never memorised this thing yet. I just keep it on my laptop. What I want you to see is that both the vascular and the neurological are divided from stage 0, you don't have it, right up to stage 4, which you never see. The point of our assessments is to decide, do they have HAVS? Is it vascular? Is it neurological? And how bad is it? Is it stage 1, early to stage 2, late stage 2? What we're aiming to do is avoid people going beyond early stage 2. And in theory, that means telling them to stop the job or to restrict them from vibrating tools. But in the real world, you can't just take someone's employment away. So we'll often try to reduce their exposure, keep them on what's often known as green tones, the ones where the vibration thing says you're under 100 points. And if that's working, happy days. If not, uncomfortable conversations. And another uncomfortable conversation is telling the employer formally that I've diagnosed HAVS, and they then have a duty to report it to the health and safety executive. As you can imagine, that goes down really well. They love it. And our final thing is to say when we want to see him again, which is going to be in a year's time. We might say, well, we'll just do a tier 2 questionnaire. If we're very worried, we might say, well, we actually want to do a full tier 3 assessment. We'll assess each one case by case. And there you have it. Everything you never wanted to know about HAVS. So, hope that's of some help to you, and thanks for watching.